Cancer's most recent episode tells the story of one athlete on her way to compete for an Ironman before being diagnosed with stage 4 colorectal cancer. Her story of resilience also includes advice from Washington University's Dr. Wang. So here to share an inside look on some of that advice and questions you might have answered is Dr. Wang herself. So first, thank you so much for joining us today.
Well, thank you for having me.
So for those who might not know, why don't we start with what is colorectal cancer?
Sure. Colorectal cancer involves cancer of the colon or rectum, and that's the last 5 feet of your intestine before the stool comes out of your body.
Okay, and who is typically at risk then?
So anyone is actually at risk. Colon
Okay.
cancer is the 3rd most common cancer in the United States. So
Wow.
anyone is at risk.
Now, is it true, however, that it is preventable?
Yes, definitely. We
Okay.
now have really good screening tests that can help prevent colon cancer, and we recommend everyone start getting screened starting at age 45. And that's a new change in the last 2 years.
Okay, and that's what I really want to emphasize here. I know colonoscopies, a lot of times you hear that when you hit a certain age. So is it true that the new age then for that would be 45?
Yes, so everyone starting at age 45 should get screened for colon or rectal cancer. And colonoscopy is one of the options. We
Okay.
recommend that every 10 years.
Okay.
But there are also take-home stool tests that you can use. There's one stool test called Cologuard that you can do every 3 years, or another test called FIT test, which you can do once a year.
And one thing people might not think about is you think cancer may be just in older people, but it is now starting even more and more to affect young people. So are we seeing a rise specifically in these cancers?
Yeah, that's definitely true, absolutely. In the last 2 decades, we've seen a number of young colon cancer patients double.
Wow.
And so it's been a dramatic increase.
No kidding. So I love this question especially. What are some foods that we might be able to focus on to prevent it, right? I think the conversation's shifting a little bit more to prevention rather than treatment.
Right. So in terms of diet, I recommend a more natural food diet, so fresh fruits and vegetables. Try and stay away from processed foods, because we do know that processed foods do increase your risk of colon cancer.
Okay, and then real quick, just about 20 seconds here, you have a young adult colorectal cancer program, correct?
Yes, Siteman, because of this new dramatic increase in young patients, Siteman has recently launched a young colorectal cancer clinic.
Okay.
And this clinic focuses on issues that might not be as relevant to older patients, but younger patients care more about fertility, how to continue working while going through treatment, and things like childcare. So this new program will support those types of issues.
Okay, well, go ahead and take a look at your screen here for further information. Now, this is Cancer Podcast. You can hear Dr. Wang talk even more alongside her patient who she had worked with on that episode for you, wherever you listen to podcasts. And you can find further information about that program at Siteman Cancer Center's website right there on your screen. Thank you so much for joining us today.
Thank you for having me.